Hi, my name is Erin Bryant, and I am a nurse with the operating room at Royal Inland Hospital. And today we are at the mock-ups for the operating theaters in the new patient care tower that's set to open in 2022. And I'm just going to quickly walk you around the OR and talk about some of the benefits. So to start at this door, we have the Sterile Court that will house sterile supplies for staff members, easily accessible from the theater. But there's also a large window in the door so that staff members who are not working in the OR that day can look through and make sure they're not unnecessarily disturbing surgery, and we can keep the door closed as much as possible. Moving over into the nursing station, it has been designed and set up so that the nurse has ample space compared to what they're used to for working on right now. But also where their workstation will be, they can keep a continual view on the surgical field. Moving through the OR a little bit more, we have these structures hanging from the ceiling that represent equipment booms that help keep our equipment off the floor, as well as new improved OR lights and video monitors that will be utilized in laparoscopic and minimally invasive surgeries. It's really nice to have these extra video monitors and lights in place so that we can move them easily and helps with the surgical procedure. Moving this way to the back of the OR, you see that there's another window. On the other side is the dedicated scrub sink for this OR, as well as the racetrack. And what this window does is allows the nurse and the surgeon, before they're scrubbing in and while they're scrubbing in, to see in the theater, again, to make sure the patient's ready and reducing the amount of times the doors open and closed. Right where I am now is where the anesthesia carts will be set up. Plenty of space for anesthesia to work and move around, increasing patient safety. And then back over towards this back part of the OR is where the scrub and circulating nurse will be able to set up the surgical field and the table. Lots of room to move around, again helping reduce the chances of contamination or infection and having to start over. So that's really great benefit. And then finishing up, just want to highlight the improved lights and airflow system. This is really great. We'll have great visual from the lights moving around the room, as well as the increased airflow down on the patient, again helps prevent infections. So that is it. Those are some of the great benefits in the new operating room. We're really looking forward to it. Thank you.